Yeah, thank you very much. First of all, I have to give my warm thanks to the organization for bringing us here and giving us the opportunity to explain our projects on eHealth. And, I've been asked to talk about not only our eHealth projects, but also how they are funded, because we have a wide experience using European funds provenient from regional development funds and make them available to innovation projects and eHealth projects. So that will be the topic I will try to explain with some examples of what we have done already. Just a first slide to address who we are and where we are. We are the northwestern region of Spain, just on top of Portugal, on the Atlantic coast of Spain. And healthcare in our region is organized around two main entities. They are public entities. One of them is the Regional Health Authority, the Regional Ministry of Health, which is in charge of the IT policies for healthcare in the region. And the second entity is the Public Healthcare Service, the Galician Healthcare Service, which is a public healthcare provider that runs healthcare services for 95% of the population of Galicia, which is about 2.7 million people. We have several resources to maintain this healthcare network as a whole working, and we have an annual budget of 3,500 million euros. It's 40% of the regional budget. So from this money, we dedicate approximately 0.9% to IT services, IT applications, and to foster digital transformation. Of course, with all this money, we have to maintain all the healthcare centers and all the professionals that work there. We have 7 main hospitals which provide secondary and tertiary services, and 7 small hospitals in the peripheral areas. We have also 460 primary care centers because we are a widespread population, so we need to have a lot of healthcare access points everywhere. And we are participating from a long time in the initiative called EAP, on Active on Healthy Aging. Of course, you all know about it. And we are also a reference site, and we have presenting mainly our mainstream project in IT, which is electronic health record, the regional electronic health record, which is called eANUS. It's a long-run project. We started in 2004. And it's running nowadays, so it's quite a long time. But it's providing, I think, very good results. Currently, all the professionals of our healthcare service are using the same electronic health record system, and this allows that any piece of information that is introduced by any professional anywhere is immediately accessible to any other doctor in the healthcare network. So that changes a lot the way the professionals exchange information and treat the patients. So there are some figures to give you an idea of what's the project about. Every day we have 10,000 users online working. They access about 100,000 electronic health records. We have also the e-prescription included in the system, and all the pharmacies in the region are connected. No paper is used to transfer the prescription information to the pharmacies, and the pharmacies also register the dispensation, and this information comes back to us again. This is made online. We have also a huge number of new documents every day. That's very important because we are registering, you see there, 83,000 documents every day with not structured information. Yesterday we could listen in some of the speeches about the relevance of big data and the possibilities to analyze this information and extract value from it. we are working in some lines on this subject. This electronic health record is now open to the citizens, and we have a patient portal. I will talk a bit more later about it. And it allows the citizens to make consultation to the electronic health record and to the prescriptions. So we have more or less 1,000 citizens daily consulting data from the electronic health record. And, well, we also have digital imaging. It's integrated, and all digital imaging of the region is also available online from everywhere to everywhere. And this system is also connected to the Spanish National Interchange system, and we are exchanging also patient summaries with other regions of Spain. This is starting, but I think we have some indicators of 200 patient summaries moving from our region to other regions. So it seems that it will grow and will work for the patients. Oh, sorry. Well, to get to this point, we had to run a long way. And of course, there are some important points around, not only building the system and putting it in place. You also need a patient ID identification number, which is unique in the region, and a procedure that keeps this identification and data updated. You also need a public key infrastructure for professionals to allow the digital signing of all this information, and also keep it updated and with procedures to give the professionals their accreditations. And you also need integration of all the information of the hospitals into the system. And of course, we need IT infrastructure. We need also servers and communications, and that takes a lot of effort and a lot of money, but it's providing results. So this was a nice picture, but of course we are facing new challenges as all the regions in Europe. And Galicia is really an aging region. Nowadays, we are reaching 25% of people over 65, and we have nearly 50,000 people over 70 living alone. And as I have told you, we are a widespread population. There's people living in the mountains, in the valleys, and the rivers, everywhere. So we really need a way to take care of them that is not the physical transportation and coming to the physical centers. Well, and if you look to these figures which are underneath, we also have not a very nice ranking, but we are also the highest number of people with more than one chronic disease. These are the regions of Spain, and you see that in the first position, Galicia has the highest number of people with more than one chronic condition. That makes also a challenge for us. Okay, so we were somehow lucky in 2011 because to accomplish all this digital transformation and to bring out new solutions to focus on chronic conditions and aging, we found that there was an operating program from European Regional Development Funds that was promoted by the Spanish Ministry of Economy that tried to foster innovation in companies and SMEs. So we tried to explain them that we could make several projects looking for new solutions in healthcare that could be developed by companies and that we could promote their development from the public sector. And they really found interesting this idea, so we got funding for 23 initiatives that were made possible through public procurement of innovation, which is a new way of making public procurement. And, well, we told them we can use ERDF for public procurement of innovation, and everything really fitted. So we launched a number of solutions under this model. It has a number of advantages. We have, first of all, these new solutions do not have a clear definition. So in this public procurement of innovation, you can start a dialogue with the companies, and you explain the companies your challenges and objectives, and they can offer you new ways or different ways to approach to the solution. So we had a good participation from the companies. We had more than 300 proposals telling us how these problems could be solved, and we took benefit of it, of course. It's also useful for the companies because we also had a crisis in 2008, 2010, and the companies also could see here an opportunity to have funding to obtain new products to take to the market, because in this modality the property of the product is given to the companies, it is not retained by the public purchaser. What we get as a public service is the availability of the solutions. We can use them for free out of paying any royalties or licenses to the companies. And we can get also some royalties from the companies if they really succeed in, they are successful in the market. We can get some months or years of evolution of the system for free also, and also with a nice price if the companies compete against each other. And finally, we try to promote internationalization and commercialization of innovation and help our companies to show these products and make them work in our region and show potential interested organizations to see how it works. So under this model, this is my first example, we developed a telemonitoring system. It's called TELEA, and it's a multi-patient, multi-professional, multi-pathology telemonitoring system. So we have a solution that basically, as a first step, the clinician or the nurse finds a protocol of telemonitoring that could be applied to a patient with a chronic illness. When this patient is included in the program, then he has a number of parameters that he can take at home, and he has a number of questionnaires to measure from home how is he feeling and how is her state of health regarding this chronic condition. And while he is at home doing these activities, the professionals can see all the information coming in their electronic health records. So we have follow-ons of these patients while they are not in the physical healthcare center. Okay, we could mixture this development also with pilots that we made at European level. We were involved in United for Health. I think also some Greek people was involved in this project for telemonitoring and piloting the results of this kind of healthcare services to patients. We also were involved in another project for mental health based on a digital platform which is called Mastermind. And nowadays, we are also involved in a new project that tries to join health and social care. It's called Activates. And I'm also aware that Greek people is also really engaged on this project, which is very promising. Okay, we have some pilot results. So it seems to work. 97% of the patients tell it's a good solution. They would like to continue using it. They also said it has improved their access to healthcare. We have registered some lowering in the number of visits to primary healthcare centers and also some less visits into the hospitals. So an estimated saving could be done looking at this reduction of the traditional activities of going to the centers, and these figures look nice to our managers. So the decision was now to start the wide deployment of the system. So we are now moving this tool to all the primary care centers in Galicia. We have just starting in 2017, and we expect to reach the full deployment by 2020. We are also creating new protocols, because we have protocols for COPD, cardiac failure, diabetes, but the clinicians request the tool to be used with some other chronic conditions, and it's a nice project that's living now. And the second example is the patient portal. It's called eSaude, and it's an interactive and personalized portal that provides access to all eHealth services that we have open. It allows the patient to access the electronic health record, to e-prescription, to scheduling, and we use a secure way of authentication. It's based on digital certificates and also in a secure user password. And we are at the moment glad with the results. We have a continuous access from new users, more or less 500 per week, and we are reaching now 32,000 users on the platform. Of course, we have an interesting initiative here, which is providing a space for patient associations. So patient associations do connect also with patients through the same platform. Okay, and the results here are also, valuable, I think. The first test we made with the early adopters was that 81% said it was an improvement in their health care. And also in the professional side, also there was a good sensation that the system was useful. Well, the clinicians are a little reluctant because yesterday we had a presentation which called "They are watching us now." So they see maybe too much transparency or a lot of more transparency than before. So they have to be aware of that the electronic health record is well written, it's understandable from the patient side. So it's changing somehow the way clinicians and patients interact. Okay, and this is the new initiative, which is called Codigo 100, and it's a new health innovation plan, which is running nowadays and will last until 2020. It comes again from an agreement between Sergas and the Galician Healthcare Service and the Spanish Ministry of Economy, and we will use also ERDF funds for new initiatives on this new period. There are three main lines: patient empowerment, advanced personalized therapies, and also aligned to improve professionals' command of digital skills and also knowledge management. Okay, these are the main steps. As we launched the project in 2016, we have published our challenges and we started the market consultation. So now the companies are providing us ideas to solve our challenges, and we have published what we call the early demand map. This is, I will explain what this is later, and this early demand map is an anticipation of the tenders that we launch for acquiring the new solutions in the public procurement of innovation model. These are some figures of the ideas that we have received, more than 200, and 73% of them were found to be interesting for the project. So that's a good result for us. And then we have published nowadays what we call the early demand map that anticipates the tenders that will be launched from now on. And on each item of this early demand map, you can see our new projects. An app for diabetes, a patient e-relationship manager, an architecture for secure and seamless integration of all the ecosystem that's being created around the patient and around the mobile devices, and, well, a huge number that I will not explain now. This is just the last slide to show all the stages that we have followed. On the upper part, you can see the ERDF funded projects, and on the lower part, you can see the complementary actions that we have performed using some other funding from European Union, like Horizon 2020 or CP initiatives for piloting these solutions. And that was all. Just wanted to mention two nice phrases that I found. One of them is from a Catalonian man called Xavier Marcet. He's very good when he speaks about innovation. And he said in one lecture that I attended from him that innovation consists mainly not in getting new knowledge, but in the skill to apply the knowledge into practice. But there is another man who said a very similar thing before. Aristotle told the intelligence consists not only in the knowledge, but also in the skill to apply the knowledge into practice. So it was just my last slide to say that the classics have everything before us. So thank you very much.